So now we're going to talk about proper sitting posture. If we look at Michael now, this is actually not normal posture, but abnormal posture. We can see his head is forward. We can also see his shoulders are slouched in. And if we look at the lower aspect of his spine, he's kind of slouching and his low back is straight. Now, before I get into proper sitting posture, I want to talk about parts of the spine that are important. Number one, cervical spine. Should have a forward curve. There's 7 cervical vertebrae that are important. They're meant to be movable. The next part is the thoracic spine, and I'm going to have Michael sit up. The thoracic spine is made up of 12 bones, and typically when people talk about the thoracic spine, they call it the mid-back. Next is the low back, from here to here. There's typically 5 lumbar vertebrae, or aspects of the spine that are part of the lumbar spine, and then the pelvis. So there's 4 parts. Now when we look at proper sitting posture, one of the things I like to do is just position people properly so that they have a good understanding of what they need to be doing. So first and foremost, we are going to be sitting upright. I'm going to ask Michael to bring his shoulders back. His head now is in good position. It's not too far forward. It's not too far back. And then what I'm going to have him do is right where his belly button is I want him to just push his belly forward. Just keep pushing it forward. Perfect. And we almost want to act as there's a hinge right here. So if we just keep him here, I have the ability to move him forward and back, but I'm going to keep him here, and I almost want him to push his belly forward. Just stick your belly out, Michael. Perfect. And then I want him to just hold that posture right there. For the most part, I ask the patient to close their eyes, take a blueprint or a picture in their mind of where their posture is, and then throughout the day, ask themselves where their posture is or isn't, and then just go ahead and make the proper corrections. It's going to take some time for us to go ahead and make improvements in your posture, so don't beat yourself up. As you notice your posture isn't where it needs to be, you have the opportunity, whether you're standing or sitting, to correct it. This is Chris Garden. I'm a chiropractor, and this is part of your mindful movements topic on posture today.